So dental implants are one of the most common procedures we're doing these days. One, because it's a great replacement for missing teeth, and two, because people are more aware of them and know that, hey, a dental implant is something that I can get that's not gonna get a cavity, that can last me a long, long time. So I wanted to answer a couple of the quick questions that the common questions we get with placing dental implants. First one, is it gonna hurt, and how long is the procedure gonna take? That's typically the first question. Well, I'll tell you that the big thing we have here that we utilize is technology. So one thing we do is every patient that we're placing a dental implant in gets a digital scan. And what that scan does is it gives us a 3D view of where we're putting the implant. That allows us to see how much bone you have, if you have enough bone, do we need to grow some bone? And that way we can predictably place your implant. That also allows us to make a guide. And what a guide is it actually controls the placement of the implant so the implant goes to the exact spot that we've digitally placed the implant. That does a couple things. One is it expedites the surgery. So now typically to place one implant, you're looking at 30 minutes. To place a couple implants, it can be as little as an hour and a half. And so by doing that, now we're minimizing post-op discomfort because we're moving through the surgery quicker, which is really nice. Number two, what happens next? So typically when we place implants, especially if they're in the posterior area of your mouth, we can't put teeth on them that day. It's a 2-appointment process. So process number one is you're gonna get the implant placed, then we're gonna let you heal for typically 3 to 4 months, and then we're gonna put the tooth on it. So think of the implant as a root replacement, and then the crown or the tooth actually goes onto the implant, and that's when you have a tooth. So typically if you walk in here without a tooth, within 6 months, you're gonna have a tooth back in that spot. Now, teeth in a day. If we're taking out all your teeth because we don't have enough good teeth to save, or you have a lot of problems, or you're missing a lot of teeth, it's not unusual for us to be able to put 4 or 5 implants in and then put teeth in the same day. So that's a really cool thing that we can do. And because of technology, we're able to do it more predictably, more affordably, and more effectively.